I am Dr. Katie. It's 8. We might get started. People may flow in as we go, but that's okay. If you're here now, welcome. I'm going to be talking about 5 daily rituals to help you thrive during challenging times. Um, Let me know where you guys are from. Tell me your story. It runs like a more like a lecture. Um, it also We've got time, for questions in the end. I can see um, Evelyn is attending from Melbourne. I don't know how that popped up. Welcome. And we've got Gabrielle, who is in Sydney. Those are the first two that I can see. Um, we've got Suresh, who is attending from India. Welcome, Suresh. But I think it's 8:01. We might get started because I know some of you have been waiting. If we have people flood in as it happens, we will include them. So just a bit about me. I'm a medical doctor and a breast cancer survivor. Professionally, I have studied psychology and anthropology at Harvard. But I'm both American and Australian. Because I was born in America, I haven't lost my accent at all. I've been in Australia about 11 years, and I studied my medicine at the University of Sydney. I'm also currently doing PhD studies there, and then I did public health at the University of Queensland, which is great fun. I've done all of my medical training and work in New South Wales. So I have worked as a doctor for about 6 years. I've done both psychiatry and general practice training. I'm finishing up my last, I think it's like 9 months of general practice training till I'm free. I'm a bit more independent. Obviously, my training was slowed a bit because I was diagnosed with breast cancer. That was at the end of 2017. At the time, it was stage 3. I had a tumor 5 inches or 7 centimeters, very large. My oncologists were worried that I had metastatic disease. I had a number of lymph nodes that were involved. I was really, really lucky that I didn't have any metastatic disease from the beginning, but there were concerns over whether the tumor would be operable. So I ended up having lots of chemo up front and hormonal therapy. I was very lucky that my cancer was hormonally positive, Herceptin negative. That's the more treatable kind of breast cancer. So I did chemo for about 5-6 months, and then I had a double mastectomy with a left axillary clearance. At the time, I was working up in the Northern Rivers area. I've spent most of my time working in New South Wales in the Byron Bay area. I love Byron. And that's where I had most of my treatments. And then I had a radiation, and then I entered my survivorship phase at the end of 2018. And since that time, I've just been on hormonal therapy. So, obviously, that time as a patient myself has really, really shaped how I view providing care for people as a doctor. And for me, I actually found this post treatment phase to be the hardest because it was the least supported. And, I was really, really focused on restoring a normal life, being well, and preventing cancer recurrence. And I didn't have a lot of guidance. So I started doing my own research. I started talking to other women who had survived breast cancer. And I was just focusing on wellness rituals. And I found, especially as I had been working in psychiatry, I transitioned to working more in general practice. And I found that for both clientele, I was having the same kind of conversation over and over again about certain wellness rituals that I found if I was doing, it was what was in line with preventing cancer recurrence. And I found across a whole host of conditions, whether it's mental health, like anxiety, depression, or physical health, diabetes, hypertension, um, you know, obesity. It's this kind of set of 5 things where if people aren't traveling well, it's usually something. One of these rituals is not happening for them. So I was really focused on my wellness early in recovery, and it felt like a burden, because I spent a lot of time, at the gym. I was 75 pounds, or about 35, 36 kilos heavier, from the steroids. And I thought that one of the gifts of having cancer was, that you lose weight. Simply wasn't the case. I'd had some mobility issues, which thank goodness are not the case anymore. And I really feared cancer recurrence. I didn't have a good quality of life. Though I was alive, my quality of life wasn't that great. And this kind of, resulted in me. This is me, right after my double mastectomy. It was a few days after the surgery at the hospital. I had it in a private hospital, and flowers that some of my friends and colleagues sent me. So that was me, slightly, 35 kilos heavier than I am now. But I just really want to point out that wellness and health prevention should not feel like a burden, and it should be something that we focus a lot more on with our patients in general practice, especially, um, as well as psychiatry. I think I actually have more time to do it in psychiatry. But my wellness rituals now look like a wellness hour, and that was key for me for it to be sustainable. So for me, it's first thing in the morning. I wake up after 8 hours of sleep, which is one of the wellness rituals that I will discuss each in depth. I feed my dogs. I've got three. I have a coffee. Funny story about one of my dogs. I've got this camp dog. It's mainly blue heeler. I've gotten it from a remote Aboriginal community that I've done work in. And I got home tonight. Someone had given me a tiramisu, which is great. I love tiramisu, even though I'm avoiding sugar. So I have a tiramisu, and I've got this Land Rover SUV thing. It's quite big. This is a tiny puppy. I put half the groceries in the car, and I left the tiramisu in the front seat, thinking there's no way any of my dogs, maybe my Great Dane, could reach it. I brought her in the house. I get outside, and my camp dog Speckles, who's about 10 weeks old, is standing in the face in the tiramisu, eating it. So I've just basically fed my puppy a whole tiramisu tonight. So I think he's going to be hyperactive, and hopefully he'll be well. Anyway, I digress. This is part of my morning routine, is feeding the dogs, having a coffee. That takes about 5 minutes. Then I do 15 minutes of mindfulness meditation and journaling to connect with myself, to bring stillness into my day. I do 30 minutes of exercise. It's a little bit different now with quarantine. Usually it's yoga at home. Weightlifting has been pivotal for me, or run, walking outside, that sort of thing. It would be a bit different if we weren't dealing with the whole coronavirus thing. And then after that, I have a healthy breakfast, and I try to make a point to send an email or call someone that I know needs more support, or I need to respond to. Because sometimes I have days where that doesn't happen. So that's kind of my wellness hour. I've slept. I have connected with myself. I've exercised. I've eaten at least a healthy breakfast, and I've connected with other people. And I've had to do it in an hour because I don't really have more than an hour to give to be able to consistently do it. And that's what I realized, is I have to be consistently doing things. So for me, after about a year, I found that I was 36 kilos lighter. I was more grounded in the present moment, and I was happy. And fulfilled. And it's not enough to just be alive. Like, we need to be living our best life. We need to feel like we're well. And wellness, it changes depending on who you talk to. And when we think about like how we define health and wellness, it's not just the absence of disease, but it's wellness. Feeling well, it's body, mind, and soul. And what that means to people, it really just depends on who they are and what they value. And it's really important, I guess, when you think about your health goals and you think about what you want in your life, and you are establishing your relationship with your general practitioner, that you have that kind of talk with them where they really understand what it means to you to have, what a fulfilling life means to you, and how you define wellness, because that really needs to shape how they approach helping you with your health and your health goals. So moving right along, I want to get into more of the nitty gritty of what actually makes up the 5 daily rituals that I have combined into a wellness hour. Because some of them are things that everybody knows, they know to do. The issue is consistently. Like, most people know that exercise helps them, but the hard thing is to do it consistently. For me, I have to have I have to be able to do it efficiently. It has to be kind of seamlessly into my life, in terms of it being a daily habit. So that's why I have started doing it just within an hour every day, and I try to get it done. So I'm starting with connecting with self, because I have found with myself and with my patients, this tends to be one of the more neglected areas. If I talk to my patients, what do you do to be well? What do you do to prevent disease recurrence? All of them will tell me, eat well, don't smoke, exercise. Very few will talk about the importance of connecting with self. So I'm going to start with this one because I think it is one of the most overlooked, in part because we're busier and more distracted than we used to be. Um, and taking time to engage in self-care is vital to well-being. It can increase your capacity to manage stress, improve your resilience. If you have any sort of mental health problems, it can reduce symptoms, and it can certainly prevent them. I haven't talked about it here, but in a later slide, I'll talk about the impact actually on the immune system. We actually know there's a UCLA-based researcher that has done a lot of research on meditation and the immune system, and at the cellular level, it actually improves your immune system. So I'll get a bit more into the benefits later, but your happiness, it's your responsibility, and connecting to yourself really allows you to understand more deeply what you need to be happy and fulfilled, and why you aren't in this moment, and what you need to do to change that. So there's a lot of different tools that you can use to connect with yourself. This is a list of things that I do, that some of my patients do, whether it's art. I'm a big proponent of using art therapy with people with mental health issues. It's very effective. I certainly do a lot of art. I do a lot of painting. When I first got diagnosed with breast cancer, that's how I worked with my emotional response to it all. I painted out my pain, and it's just what I needed in that moment. Certainly yoga for me, both yang and yin. I love going to yoga retreats. If it wasn't for coronavirus, I would probably have gone to Bali recently, to do yoga for the weekend. I'm currently based in the Northern Territory, though. I'm permanently in the Byron Bay area in New South Wales. So I've highlighted meditation because of the things on this list. I think that's the most powerful tool, but certainly they all have a place, and you'll find that sometimes you need other things more, than one versus the other. And the more tools that you have in your quote unquote wellness toolkit, the better, right? So for some people it's travel. I mean, it's what works for you. But to talk more about mindfulness, meditation, and journaling, I think it's a powerful tool to help you connect with yourself. It creates this space in your life to find stillness, to listen to your inner voice. And there's a huge research base. I mean, this is not new. It's something that, Buddhist monks have been doing for a long, long time. And then in the West, we've actually been researching meditation since the 70s. And so there's now a very strong evidence base for it. And it's certainly played a major role for me in helping me thrive with breast cancer. And part of the reason I gravitated to it is because when I was struggling in my recovery phase and I wasn't getting a lot of help from my doctors, I said, you know what? I'm going to be my own doctor. I'm going to sort out what I need to do. And I read, and I found a couple of really good Cochrane reviews. So, I mean, these are big studies where they've looked at multiple studies over, the span of decades. And they actually had a couple of Cochrane reviews that looked at the use of meditation and cancer recovery. And I pulled from that and I said, okay, you know what? I can see there's an evidence base for it. I know there is for my patients with depression. I'm just going to give it a go. The more that I've learned about mindfulness meditation, the more that I have integrated it into the work that I do with patients across multiple specialties, the more powerful I realize that it is. And I agree, the research is right, and what people are saying anecdotally is right, and I found it to be true in my life. And so that's why I'm trying to provide free resources for people. This list of the benefits of mindfulness meditation is not an exhaustive list. I could have made it longer. We'd be here all night. But just to highlight a few, and these are the ones that there is the most evidence for at this juncture, about 50 years of research to be exact, is reduced stress, improved mood, reduced anxiety, improved focus and cognition. It can enhance your immune system function. It can decrease chronic pain, and it can improve sleep. And what's the mechanism? Well, if you look at the schemata, when you meditate, there's actually changes in your brain. They've done imaging studies that look at the functional changes in your brain, how much the brain is, I guess, turning on. And they've done that immediately after people meditate and do mindfulness meditation. And then they've looked, at someone's brain after they've been meditating consistently, every day for an hour or for 20 minutes for the last, 2 months. And they've seen how the brain changes. And they've actually seen changes in the brain, in the attention, the emotional areas of self-awareness. And so they think that as you meditate, as you focus your attention on the breath or on a body part, that practice helps you refine your brain's ability to do that. It's kind of like when you weight lift and you use a muscle, you're strengthening that muscle. You do the same thing with the brain. They found that in the parts of the brain that regulate emotion and self-awareness. And part of how you train your brain when you meditate with that is the practice of meditating, focusing on the voice or a body part. And then you've got these thoughts, you've got these motions, they distract you. And then you realize, oops, I'm no longer listening or focusing on the breath. I've actually been distracted by, this worry that I have about, losing my job because of coronavirus. As you acknowledge that, but without judgment, and then you bring your attention back to the breath, you feel the emotion in that moment, and that's associated with the thought, and you acknowledge it, and you bring that thought back to the breath, and that focus back to the breath. You actually are training yourself to tolerate your emotions, and not have your body not respond with the same level of stress that it would. And you actually see that your brain changes. I mean, it's just fabulous. In this next slide, I kind of go in a bit more detail about it. But if you look on the slide, the dark blue parts of the brain are regions of the brain that they have seen change because of meditation. And you can see these areas. It's, the area, if you see the amygdala kind of in the bottom middle part on the medial view of the brain. I think I can highlight it. You can see my cursor. That is one of the emotion centers of the brain. This changes with meditation. Um, the front of the brain here, the prefrontal cortex, is an executive center. It does a lot of stuff to help control and plan on things. And so you can see that this area is light up. It's working in conjunction with some of these other parts of the brain. If you look at the lateral aspect, you can see a center, so this lateral view, you can see insula, that's changing. That is a role in self-awareness. And then if you look again back at the medial view and you see this posterior cingulate cortex area, this area is really, really great as well for attention control. So, this is something that it hasn't just been demonstrated in a few studies, it's been demonstrated in a lot of studies. And if you're interested in learning more, I've put one of the Hallmark articles and where this image is from. It's a 2015 systematic review in Nature Reviews, which is a very high impact or very important scientific journal, where these researchers have actually looked back over the last 30 years or to 50 years of research, and they've actually synthesized it all. And that's where this figure comes from. So it's not just one study, it's from 50 years of studies. So I hope that hasn't bored you. I do like neuroscience. I'm a little bit nerdy. I hope I didn't lose anyone. If you have any questions, you can always type them in the comment box. Now, if you are interested in mindfulness meditation and journaling and you haven't ever tried it before, or you want some more supports, I do have a free ebook, and it's a 30-day program to help people in their first 30 days. Part of the reason I made this is because I found that a lot of my patients wanted help with it, but they didn't have many resources. And part of the reason I combine mindfulness meditation and journaling is because the journaling task, after you have centered yourself and you're kind of stuck with your thoughts, a lot of what I do in therapy, which is more of a cognitive behavioral approach to dealing with negative thoughts and emotions and switching them, combating them so they're more positive. We use cognitive behavioral techniques, which can really be harnessed while you're journaling. And I found the combination of mindfulness meditation with using these tools that we teach through cognitive behavioral therapy can be quite powerful. And I found, certainly in my journey with breast cancer, that as I was trying to move on, as I was trying to combat fear of cancer recurrence, I mean, that was the big thing that was impacting my life negatively, that I just improved a bit faster when I used some of the cognitive therapy techniques that I was using on my patients, on myself, and I combined it with the mindfulness meditation. If you're interested in just mindfulness meditation on its own, that's also a powerful tool. If you need supports, you can check out my website. I've got this free ebooks for anybody to use, not just my patients. And then we also have a Facebook group, which is just for people to say, this has worked for me, this hasn't. I also participate. And it's just a community, really. So we can support each other. Also, the last thing is I've done a course. I've had so many people come to me wanting more support, asking more questions. So I've just turned it into a course, which will be launching in 2 weeks. And this is what's included. If you're interested in something like the course, let me know. Type yes in the box, and we can try to send you out a discount code or something for it when it is launched in 2 weeks. I don't know how much it will cost. It's really important to me that we are providing people with everything as free or cheaply as possible, because I think that healthcare is a basic human right. This is what will be in the course. So if you're interested, let me know, and we can try to email you out a discount code or something. I will talk to the marketing people. The guided meditations, I'll say that they're 5-minute one. There's one that's video recorded, and there's an audio recorded, and there's a transcript of a 5-minute meditation. Then the 15-minute meditation, I think, is video recorded. The 30-minute guided meditation, the 60-minute guided meditation are more like an audio file for you to be able to listen to. And then, I guess I've said enough about that. Let's move on. Let's move on. So, moving on, I've chosen sleep, the ritual of sleep next, because again, this is one that I think is overlooked, especially outside of psychiatry. I don't know if any of you have ever met a psychiatrist or seen one, had a psychiatrist as a doctor. We are obsessed with sleep. I mean, I am obsessed with how my clients are sleeping, in large part because people who are sleeping are traveling well. When people are unwell, they're either sleeping too much or they're sleeping too little. If people start to not do well, they use the first saying, what we call an early warning sign that someone's starting to not cope, is that they're not sleeping as well. And I know that I need to act fast to prevent someone from becoming unwell. Maybe they had depression in the past and had to be hospitalized because it was quite severe. I know that if they're starting to not sleep again, then I need to help them, support them more. Maybe if medications played a role in their treatment, increase it, because this is an early warning sign. Likewise, if someone's not doing well, whether it is, they've had a heart attack, or they are having a manic episode, if they're not sleeping and I'm treating them and they're still not sleeping, they won't get better no matter what else I do. Sleep is very important. Let me get into it further. It's just people don't think about it as much as eating well and drinking. We know now that sleep is as important as what you eat, what you drink, and breathing. I mean, that's a pretty profound statement. Poor sleep increases and results in a tenfold increase in the risk of developing a mental illness. I sort of talked about that. And people with chronic sleep issues actually don't live as long. We need this time for our body to repair itself and to help our brains. If we aren't sleeping, we're going to have weaker immune systems, which leads to, more likely to have disease, to get sick, to get the flu. And it can lead to mental health problems. Now, how much are we sleeping? This is actually an American-based study in 1942. The average American was sleeping about 8 hours, which is good because that's what we should be sleeping as an adult. The amount of sleep that you need changes depending on whether you're, 6 months old or whether you're 40 years old. But in 2013, the average American was only sleeping 6.8 hours, which is quite significant. The reason being is, if you look just at the top right, the health risks, you can see that adults who sleep less than 7 hours a day are 30 more times likely to be obese than those who sleep more than 9 hours. I mean, that is pretty profound. And, despite everyone dieting over the last 50 years in America and in Australia, people are getting fatter, and sleep is playing a role in that. Now, this schema is actually it's UK-based data. I don't know if you can see the bottom, Rand Europe. This is actually UK-based data. They found that annually the UK was losing $30 billion to poor sleep, and that 1 in 3 people in the UK was infected by insomnia. That's a lot. That's a lot. If you slept less than 6 hours a night, you were 13% more likely to die than someone who was sleeping at least 7 hours. I mean, that's crazy to me. And we spend a third of our lives asleep in our bed. I mean, that's why I justify getting those like bamboo soft sheets from Adidas, or Egyptian cotton high thread count sheets that are like really expensive. This is how I justify it. We need at least 7 to 8, 9 hours of sleep. We just do. So, what do you do about it if you're not sleeping well? Because 1 in 3 UK-based people aren't sleeping well. I think the Australian data is quite similar to that. Well, if someone comes to me and they say, "Doctor, I'm not sleeping well," the first thing I do is say, "Okay, why?" We need to make sure that there aren't medically treatable causes like sleep apnea, heart failure, hyperthyroidism, severe, maybe someone's having a manic episode, for example. And so we need to rule out medically treatable causes. For most people, this isn't the case. It's actually poor sleep hygiene. And I'll talk more about that later. If there is something to treat, we always need to treat the underlying cause. Most people say, can you just give me a pill? I want a pill. I'll just take it, for the rest of my life, or for a short period of time, and I'll sleep. Very few people does medication actually play a role. If someone is very unwell, they're having a manic episode, certainly we need to be giving them medication so they can start to sleep so they can get better. It would be short term. For most people, working on good sleep hygiene is key and is treatment enough. For other people, they need more. Then we look at, things like meditation. There's actually a huge evidence base there. Cognitive behavioral therapy is now being used more and more. And then medication, if there is a role. And there is a role for some people. It's not a one size fits all. Usually, though, the problem is people come and they say, can I have a tablet? And without wanting to do any of these kind of rules of healthy sleep. And unfortunately, if you have a tablet sort of buys you time for many people to get the rules of healthy sleep right. Because most of the tablets we get with time just don't work as well. So this is sort of the big thing. We know if the temperature's cold, if it's dark, if it's quiet, you're gonna sleep better. We know that if you're smoking and drinking a lot of alcohol, smoking, people don't sleep as well. I don't know all the research there. Alcohol, even though you drink a bunch and then you pass out, it actually interferes with the deepest level of sleep. This REM sleep, the delta waves, they're brain waves, and they're parts of the sleep cycle that you need to feel restored. You actually don't enter when you have alcohol. And so it's one of these weird things where, like, I don't, I never really drank much till I came to Australia. People drink a lot here. And I can just remember going out and having, too many beers and just falling asleep immediately, and then waking up and not feeling well rested. And that's because although I could quickly fall asleep, I actually wasn't sleeping deeply. So that can be a thing, if you're drinking too much alcohol, that can be an issue. Exercise before bed can help. Giving up caffeine. I love coffee. And I just have to limit it. I can't have more than 2. They have to be before noon, or I just don't sleep well. And that's just how it is. This is, it should say energy drink, but you get what they're saying. Make sure that you have the right sleep environment, the right mattress, right pillow for you, Nest. Another thing that there's a huge body of research for now is looking at screens. So, any sort of screen in your face can interfere with your ability to sleep. So, some people, their bedrooms become their sanctuary. They don't have TVs. They don't, sit with their phone before they sleep. And then the other thing is really just picking a good time to go to bed and having it be a ritual. Every day you kind of wind down at 9, you're in bed at 10, you're not sitting in the bed on the phone. I am like very guilty with, having a great sleep routine, but then I take my mobile phone into the bed and I sit there and I'm like on the phone messaging people, reading, looking at Instagram. It's horrible, and it kind of blows my routine, or whatever. So yeah, don't be like me. Don't do that. If you struggle with sleep. So these are the rules of healthy sleep. And usually people who have problems with insomnia, there's something here that's amiss. And I have a really great handout that I usually give, all of my patients that are having issues with sleep. And it's something that we just work on. And it can be hard. I mean, it can be really hard. You have a work party or something you want to go to, and you're trying to keep a regular bedtime of 10 o'clock. I mean, how are you going to get home? It's like a Saturday night. But, investing in your health and your wellness pays. So if you're struggling with sleep, talk to your doctor. Now, healthy eating and exercise are the next two. I'm not going to talk about these as in depth because there's so many resources. I will give a little bit of advice that I give my patients and myself, because I have always been overweight. I've always struggled with my weight and with sugar. And so healthy eating has just always been something that I've had to focus on day in, day out. And sometimes I'm winning, sometimes I'm not, but that's okay. Any positive choices is an act of self-love. I will point out this really interesting study from the Harvard School of Public Health, where they looked at people who were eating a diet high in plants, low in fat, exercising, avoiding smoking, lots of alcohol, and they found that women lived 14 years longer and men lived 12 years longer. I think that's pretty profound. So what diet are you eating? What advice are you taking? Are you doing keto? Are you vegan? There's also like the keto vegan thing. I don't know if anybody's watched the YouTube videos recently on this whole keto vegan movement. I find it very interesting. There's Weight Watchers, there's intermittent fasting, there's paleo, there's the Mediterranean diet. There are meal delivery services, shakes, surgery. I find it really confusing. And one of the things I thought was when I got into medical school, I'd learn all this stuff and I'd know what the perfect diet would be. And really, I just was more confused than before. There's so many arguments in the literature. Should you have fat? How much meat should you have? Should we have carbs? And there are arguments. There are some things that no one is arguing about that transcends any of these diets. And those are, everyone knows that refined sugar is the devil. And, no one's arguing about needing whole foods, veggies, for example. At the end of the day, you need to do what's best for your body, and helps you win. And the most important thing is consistency in what you do, consistency in making choices that you can sustain long term. I can tell you that on that list of diets, I've tried almost everything. Some of them are more consistent than others, but I don't know that I'm someone that's going to be able to track everything they eat for the rest of their life with Weight Watchers or MyFitnessPal. I don't know that I can spend the rest of my life not eating bread. I mean, my goodness. I would just have to avoid going to France. I mean, maybe that's just not an issue right now in the coronavirus. I've gotten to a point, I guess, where, I want to lose more weight. My big thing is avoiding refined sugars, and, just consistently trying to make good choices. And I think another thing to remember is that wherever you are, love in yourself and accept yourself in this moment. Be body positive. Be hopeful that you can improve your health, yes, but remember that your worth isn't tied to your weight, to your choices, or to your willpower. I mean, willpower is a really interesting thing. Part of what has helped me be successful in my weight loss has been shifting how I think about losing weight and healthy eating. Instead of viewing exercise and eating as something I have to do because I'm not genetically blessed, I can't get away with eating certain things that my very thin friends can. I view it as an act of self-love. Anytime I make a positive choice, it helps me prevent my risk of breast cancer recurrence. It extends my life, and it should be celebrated. And I've also accepted that if there's a cookie in the house, I'm probably going to eat it. So I don't believe that I have willpower. I just don't have a cookie in the house. And I plan. But the biggest thing for me has been remembering with this wellness stuff, with these 5 rituals. You'll have good days, you'll have bad days. You'll have days when you just don't feel like doing anything but sitting on the couch, watching Netflix and eating ice cream. I don't know. But if you wake up the next day and you make better choices, there's a benefit. There's a health benefit to that. And you can't be beating yourself up for some of the, less than stellar choices that you might make. Every good thing you do for yourself is an act of self love. And you're beautiful and wonderful in this moment. Don't forget that. Don't forget that. So I digress. The next thing is exercise. Again, most people know you need to exercise. And part of the reason doctors harp on about exercising is there's so many benefits. Again, this is not an exhaustive list. But if there's an issue that you need help with, if you exercise, it will probably help you. In mental health, if you look at improving the mood, one of the things that I still just can't get over is that actually when you exercise for at least 30 minutes, just enough to lift your heart rate, your brain is actually emitting a neuropeptide that increases serotonin in the brain. In the same way that taking an antidepressant works. It really is a happiness drug, like literally. And it's very important to your mental and emotional well-being, reducing cancer risk. I know for me with breast cancer, my breast cancer recurrence is reduced by about 80% if I'm exercising. So that's a huge incentive to exercise. And even with that, sometimes the alarm goes off. It's 5 a.m. I don't want to get out of bed. And I got to remember that. So I don't know. I think it's important to have a why. That part of, thinking about what a fulfilling life is. Part of, I think, mindfulness, meditation, and journaling, putting yourself helps you be more in tune with what you deeply need to be happy in an authentic way. And when you know that, you have a why. And I think that when you're doing habits on a day-to-day basis, you really have to have a deep understanding of what your why is. So, how much exercise do you need? The guidelines vary. These are the Australian current national guidelines and the American guidelines. Doing any physical activities better than none. Gradually build up if you're inactive. It used to be we recommended, it was something like 30 minutes, 4 or 5 times a week. Now they're saying, actually, the more you do, the better. It's better if you exercise all day. We're realizing more and more the importance of strength-based training, especially if you're post-menopausal as a woman and as you age. And so now this is a new thing. 20 years ago, the strength training, I don't think was in the guidelines. Now they're saying at least 2 days a week. For me, I do more strength training than that. And I found that's what my body needs. Listen to your body. So the last ritual is connecting with others. Which to me, it has to be a ritual. We live these lives that are just so fast-paced and technologically driven. Even though we have more ways to connect with people, we're actually less connected, which is a problem. Because feeling connected is really important to thriving. Now, these next few slides are infographics that come from the Stanford Center for Compassion and Altruism Research. It's a great website. I suggest you check it out. And they have done a lot of research on connectedness. And I think, this is pretty profound. If there's a 50% increased chance of longevity, people are living longer if they're more connected. People have a stronger immune system if they're more connected to others. They're less likely to have anxiety and depression. You just live a more fulfilling life. And I want to point out some of the dangers of low social connection, slower recovery from disease, worse health outcomes, whether it's And it's not just mental health outcomes, it's also things like high blood pressure, obesity, and higher inflammation in the body at the cellular level. And more, a lot of disease is all pinned back on inflammation. It starts out as inflammation in the body. Obviously, there's a higher susceptibility to depression and anxiety. And yeah, it's really important to be connected. But we know, I hinted at this, that, not feeling connections or connected is on the rise. If we look at the American data, a study from 2004 showed that 25% of Americans didn't feel like they could share a personal problem with someone. It's horrible. Um, Loneliness, isolation, and alienation is just simply on the rise, and that worries me. Reach out. Reach out if you need help. So, how do you solve this problem? The good news is when we look at social connection, it's actually the subjective feeling of being connected, as in, it's not like a magical number of friends you have to have or a magical number of social events that you need to attend. It's individual to you. What do you need to feel like you have supports, in times of need? If you're an introvert or loner, you don't have many friends, some people, they need to connect in different ways than others. I'm one of these people that really needs more deep and meaningful connections. I've never been someone that's had, 50 friends that I hang out with all the time at parties or for sports. That's some of it. I've always been someone that's had more, like, 5 to 10 really close friends that I have really deep bonds with, that end up being lifelong friends. It's different for me. I had a partner for about 6 years where he was someone that always needed to be doing stuff. And he always had, 25 to 50 friends that he was, going out to the pub with or playing golf with or, doing that rowing stuff on the river. Is it cruising? I can't even remember what it's called. So that for him was a really important part of being connected, and feeling connected and supported looked like a very different thing for both of us. So what is it for you? The important things is that you just feel that you have the supports that you need. So in summary, these are the 5 things: sleep, eating well, and nourishing your body really is also avoiding certain toxins, exercise, connecting to self, which I think is the most neglected, and connecting with others. And then, this is my wellness hour, just to review it. What does yours look like? It doesn't have to look like mine. The whole thing about having rituals is that you integrate them into your life in a way that's sustainable long term, in a way that will work for you, and that as you do it, eventually, it becomes more second nature for you. Some of this stuff is more second nature. Some of it still feels like work. And part of it is waking up every day, remembering your why, and recommitting to yourself as an act of self-love. I do my wellness hour in the morning because that's what works for me. The idea is that you take these 5 wellness rituals, they're principles of wellness, and you figure out how to integrate and apply the principles in your life in a way that is sustainable. So that ends my portion of discussing the 5 rituals. If you have any questions now, please feel free to type them in the chat box. Now, if any question, I'm happy to answer any question. If anybody is interested in the mindfulness journal, I think that we will be emailing it out if we have your email after the webinar. I think that's going to be the case. I'm also happy to put the link in the text box if it interests you to have a look at it. And there we go. We also have I've got a podcast, and I can try to put the link. Maybe Suresh? Yeah. How can I join the Facebook group? Sure. So it is, I can add that link as well. I think we've just started this Facebook group. So far we've got about I think 100 people. It's grown a lot faster than I thought it would. Now I see Kareen, is that how I say it? And Kelly, they have questions about sleep. So I was going to ask Kareen, what do you think are the barriers right now, issues with you not sleeping well? Maybe we can help you brainstorm some ways to improve your sleep hygiene if you feel like that would be beneficial to you. And then type back if that's the case. Kelly is also asking for sleep. Does it matter what time you get to sleep, or just as long as you get the hours? This is an interesting question. I think it does. We've got a natural circadian rhythm in the body, and it's regulated by melatonin. And one of the treatments, so the medication that there is a moderate level of evidence for, is actually taking something to increase melatonin in the brain. It's used a lot when people travel to different time zones. Maybe you go to Europe for a few weeks and your circadian rhythms are off. More and more we're prescribing this. I think that there's a moderate level of evidence for the use of melatonin for up to 6 weeks. I've found anecdotally that for my patients that have severe issues with sleep, it doesn't really work. I don't prescribe it that much, but you actually don't need a prescription for it. You can buy it in the chemist in Australia. Now, the body, with your circadian rhythm and with the hormones in your body, they cycle. So the insulin, your blood sugar, your cortisol levels, um, they all cycle in a similar way that's related to when you should be waking up and when you should be falling asleep. We know that for shift workers who are, say, working at night and sleeping during the day, they have issues because of that. So, yeah, I do think it matters. I think that it's better if you can have your sleep cycles be closer to sunset and sunrise. I don't know that that's realistic. For most people, we say try to go to bed between 9 and 11 and then sleep your 7 to 9 hours. But even just midnight is fine. It's just if you're going to sleep at 4 in the morning and you're sleeping until 1 p.m., there may be issues with that. You might not reap as many of the benefits of good sleep because it's not going to be in sync necessarily with how your body is hormonally. And I don't know that we fully understand why that is. And it just tends to be that if people sleep with the sun, how the sun set and rises, that they do better. And it may just be, how we've adapted as humans for so long. So I think that's a really interesting question that you ask. And that's the recommendations that we give, just because we're not sure. We're not sure. So, the mindfulness link I put up at the top, the one that says webinar, Dr. Katie Moment, goes to the mindfulness journal. The mindfulness journal page, you can just download the journal there. But it is a program in the sense that once you download it, you can get emails weekly, basically with it includes tips that I am including in the course and tips that I know when I'm working with my patients. So I was talking a bit about the mindfulness journal, and it's there's 30 days of mindfulness journaling prompts to help people, and then there's a supportive email that you get once a week if you want to help. And then I've also incorporated mantras. I think that um, mantras are also a really powerful thing. So I talk about that in the book as well. Now, in terms of the Facebook group, I was also going to put the link up for that, but I got distracted. Um, we've got a Facebook page called at Dr. Katie Jeffress. It's my Facebook page. Feel free to go and like it if you want. The group is linked off of that, or you can just look on Facebook, and it is the mindfulness. It's called mindfulness journaling. It should be findable. I'm just grabbing the link now, and gonna send it through. So that's for the Facebook group, which I try to participate in as much as I can. Any other questions about anything at all? A big part of why I have started this social media stuff is I find working as a GP, we are so time pressed. We spend a lot of time diagnosing and talking about treatments, and it's usually like tablet based stuff. We don't get a lot of time to talk about wellness and health prevention. And part of that is because of time pressures, and part of that is because of how Medicare pays out for billing. And so I started this because I really think people need free resources and guidance to help have more holistic care. And so that's why I'm doing these webinars, and that's why I've got all the social media stuff. And I can also put a link to my website, because we will have more things rolling out in the coming months. And as much as possible, we will have be made free. I also have a podcast where I talk about mindfulness, meditation, and journaling. This week, I was talking about on the podcast using how to use cognitive behavioral techniques to question negative thoughts and reframe them, and change them into more realistic or positive thoughts. So that is what's on the podcast this week. And then every day we have I've got vlogs that come out on various topics that are suggested, and then we'll be rolling out the courses. And then I'm also working on a peer support app. So, and that will be a free thing. It's going to be called Thrive with Me. So that's going to probably hit app stores in about July, which is very exciting. It was something I really wanted to do when I was sick. With breast cancer, and wanted to meet other people that also had breast cancer, and that were young and still working. And I didn't meet a lot of supports because I was always working when they had support groups. Does anybody else have any questions? I can see one more person typing. You keep losing connection. Okay, well, I hope anyone who's in a part of Australia with a big storm is safe and doing well. Next week, we will be having a different webinar. I'm going to start doing a few webinars that are specifically on mindfulness, meditation, and journaling. So stay tuned for that, and keep in touch. I can get email. My email is listed on the Dr. Katie website. I am also reachable through Facebook. Feel free to drop me a line. I try to respond to as many emails personally as I get, because I love talking to people, and I love hearing people's stories, and making as many connections as possible. It's great. Any advice on taping? What do you mean by that? Like if you tap a lot? I'm not quite sure what you mean by that. Maybe a spelling error. If anybody wants to clarify, I'm happy to have that information clarified. Otherwise, it's been great. Keep in touch. Um, and until, oh, here's a link. Hold on. I was going to say until next time. Oh, okay. Yeah. I haven't used this, but it does work. What I will say is that this and acupuncture, there was a really interesting study that came out in 2017 that looked at acupuncture in particular, and EFT, and they compared it to things like CBT and to meditation and to Tai Chi, and they were looking specifically at treating depression, and they found that these things were all moderately too strongly effective. And that sort of blew my mind, that CBT and acupuncture would be almost as effective. CBT was only slightly more effective, but they found that meditation, acupuncture, Tai Chi, they were all very effective. And they were looking at the results of many studies, many randomized controlled trials over, it was something like a decade. And they found that it was. So I thought that was really interesting. I know that doctors are really taught to push going to see therapists, but acupuncture is almost as effective. So if that's something that you're into, that works for you, go for it. In terms of other mental health outcomes, the evidence base is varying, but certainly there is an evidence base for acupuncture. I've done it for pain, and it's been quite effective for me. And there is a big evidence base for pain. I'm not as well read on the use for anxiety, but it does. I know that it does work, and reducing stress. So I'm a big proponent of it. I recommend it. I recommend it to my patients. The thing is, find out what works for you. I mean, I certainly read the research studies, and the numbers are important. I want to suggest things that there's an evidence base for, but at the end of the day, we aren't numbers. And if you find that something is working for you, do it. You know, do it. As long as it's not something that's like super harmful. I mean, obviously, I wouldn't, tell someone to be drinking poison, but you get what I mean. You get what I mean. Okay. Any other questions? Okay. Well, that's it for today. Thanks for everybody who has attended. Thanks for all the questions. And I hope that there's something that I've said today that will help you thrive and live your best life, or that was reaffirming. And if you need any support, please reach out. Thank you.